Britain's locked-down economy shrank by 1.5% in the first quarter of the year, but the Office for National Statistics says there was a strong bounce back in March when it grew by 2.1%. And the UK government says it can't rule out imposing regional coronavirus restrictions to combat future spikes. Although cases are falling in the UK as measures are relaxed, 28 local authorities in England now have rates that are twice the national average. Manx Radio News at 3 minutes past 12, our next at 1 o'clock. In the meantime, keep up to date by following Manx Radio on social media or by going to manxradio.com.
Most ShopRite stores will be open between 8 and 9 on Tuesday, Thursday and Saturday mornings for our senior citizens and vulnerable customers. Please check your local store for details.
Got a news story for the Nation Station? Email newsroom@manxradio.com.
Good foster carers come in all shapes and sizes and from all walks of life. It's who you are, not what you are, that makes the difference. You could be the one to help a child or young person become part of your family. Show them understanding and help them overcome their experiences. The Mockingbird programme is a model of care that strives to recreate normal family life for children and young people in foster care. To find out more, including how we support and reward you, email familyplacementservice@gov.im.
Manx Radio Weather with Manx Glass and Glazing.
Gurumaya, thank you, Lewis. From the Ronalds Way Met Office, there are no warnings in the North Irish Sea for the next 24 hours on the island today. Dry with variable cloud, showers coming in later on, a light breeze up to 14 degrees, but lots of blue sky. Dry and partially cloudy overnight, down to 7 degrees. For Thursday, Jardine, mainly dry with occasional showers. Daytime maximums 15 Celsius. Low temperature 6 through the night. Into Friday, Jehenya, risk of showers first thing on Friday, then dry, partially cloudy. Just a light breeze, top temperature 14 degrees, so a nice day. High water at 20 to 1 this afternoon. Low waters at 7:01 tonight. The sun sets at 9:10, so it's getting dark about 20 to 10. High water 1 a.m. Sunrise tomorrow morning is at 5:19, and the morning low tide 7.
Find the latest ranges of high-tech windows, doors and conservatories at the Manx Glass and Glazing showroom on the Snugborough Trading Estate.
Waltons have the largest stock of TVs with great deals ready to go. From the latest Samsung QLEDs to LG OLEDs. Visit Waltons. Call 611 711 or go to waltons.im.
Your dog will love the excellent doggy daycare at Coach House Kennels in Cattery, with plenty of outdoor space and experienced staff. All breeds and ages are welcome. For the best value in doggy daycare, call 812 990.
Love a great night's sleep? Then you'll love the bedding department at Loonies of Ramsey. For quality duvets, pillows and mattress protectors, along with stylish duvet sets and bed linen. See and feel luxurious bedding at Loonies of Ramsey.
If you run a small business or just need more room in the back, Philshaw Vehicles has the perfect van or light commercial for all your needs and can sort out any finance. Based in the Tremode estate, view philshawvehicles.im or call 49 51 49.
The Mannin Line with Andy Wint.
Good afternoon, 12 on Manx Radio, the Mannin Line with Department of Health and Social Care Minister David Ashford. On till 1 today, text 166 177, SMS, email studio@manxradio.com or call 66 13 68. No new cases of COVID-19 reported yesterday, so if there are no new cases today, it'll be 10 days since the last one. We currently have 11 active cases of COVID-19 on the Isle of Man, 10 in the community, 1 person in ICU in Nobles. 213 people were waiting for results yesterday at 4 o'clock. 68 people in for tests today, and from the vaccination dashboard we spot that 61,079 people have had a first dose, 15,896 second dose. There are 3,262 people booked in over the next 7 days, and DHSC is currently holding 11,012 shots of vaccine in stock at the moment. My pleasure to welcome Minister for Health and Social Care, David Ashford, with us today.
Good afternoon, Andy.
Good afternoon. It's good to see you as well. And it seems like we've been doing this forever. This time last year, we couldn't have thought what we were facing.
We really couldn't. We knew we'd seen what was starting to happen around Europe, what was going on, but we just really couldn't have believed we'd been in and out of it 3 times now. The Manx public have been absolutely amazing. I know it's been harder with each and every lockdown, and the last lockdown was particularly frustrating for people, but we've pulled it out of the bag again, and hopefully with the vaccination programme now, we're on a clear pathway to some form of proper normality.
OK, first with us, Howard's with us now. Good afternoon, Howard. You're with David Ashford MHK.
Good afternoon, Minister.
Good afternoon, Howard.
Andy. First of all, congratulations on seeing us through the pathway safely. I hope your shoulders are aching from pats on the back. But my question is, and I found this out of recent, it's a continuation of a refusal, basically, to give appointments at doctor's surgeries, ours in particular. My wife, her prescription was about a fortnight ago, and on the bottom it requested make an appointment as a review for your medication. She tried that and was refused point blank. And then the other day she went up and they said, oh, you'll have to phone at 8:30 in the morning. Now, this seems to be a regular occurrence now. I don't know how often it's happening with other clinics, but the one that we use, it's been one that's been in being for not months, not the COVID, but prior to that. It was even in, Kate Beecroft's days. And you got one hell of a job, to get an appointment with a doctor. I asked for an appointment. I have type 2 diabetes and I wish to have a blood test, etc. I couldn't even get a form to go for a blood test. And this seems to be an ongoing thing. And I know a lot of people are absolutely frustrated with the fact that you have to get up at the crack of dawn. And my wife on Thursday, I think it was, she got up and it took her 3/4 of an hour to actually get through and finally get an appointment. But there seems to be a stone wall at the reception and the doctors are hiding behind this. They can no longer blame COVID because hopefully that's in the past.
And which surgery is it, Howard?
I will name it. I wasn't going to, but I will do. It's Palatine.
Okay.
And I went up there, as I say, with my type 2. I had an appointment with the nurse, it's a good while ago now. And I sat and waited, and a nurse came out, okay, Mr. Coyle. I went in. My appointment had been cancelled. The nurse that I went to see wasn't even a diabetes nurse. And the diabetes nurse that I intended to see or wanted to see, she hadn't even been told. And I asked management when I went out. I was curious. Oh, sorry about that. Blah, blah, blah. We'll make sure they haven't goes. It was the person who was saying that cancelled all the appointments.
Okay.
Well, in relation to doctor surgeries, Howard, they are private practices, so they are responsible for their own visitation policies in terms of when and where they see people. Now, over COVID, obviously, there was a situation where they had to do everything virtually, but that should now be starting to return to normal. There shouldn't be any reason that people, if they require a face-to-face appointment, shouldn't be able to get that. We've had correspondence about something different before, and I'm more than happy if you actually email it to me for me to have that individual circumstance looked into to see what we can do about it.
What sanction does the department have over GP practices? I mean, as you say, they're separate, they're businesses, they have to operate, but they do answer to you, don't they?
They do, but it's in terms of the contract. So the control we have over the GPs is in relation to what is stipulated in their contract. If it's not within their contract, which visitation policy isn't, then basically we can give guidance, which is what we did throughout the entire COVID-19 period, and we tried to help and support the GPs through, but we can't actually dictate to them. But like I say, now we're out of the period, there should be more face-to-face. There's some things, such as medication reviews, that can be done over the phone, particularly if they're repeat medication reviews, but there shouldn't be reasons that people aren't able to get a face-to-face appointment if it's medically required.
Well, that was exactly what happened. It was at the reception. It wasn't over the phone, and it was a refusal. Say, I'm sorry, but there's no appointment. You'll have to ring up in the morning. So my wife just said to hell with it and took the prescription and got the prescription down to the chemist. But it makes you wonder, as you said, and your words, and I've said it many times, that a doctor's surgery now is no longer for patients. It's a business, and the people going in are customers. But it's our money, the taxpayers' money, that's paying for all the doctor's surgeries. So surely the likes of the buses, if you buy a bus, surely you'll be able to use it. But you bought a business or buying into a business as a doctor's surgery, and the patients can't use it.
Okay. All right, Howard, thanks for that. That's an important point, Mr. Ashford. It seems that standards of service can vary from practice to practice. Where does the department stand on that?
They can, and there is work going on to try and standardise things across primary care. There's primary care at scale models that are built into the St Jonathan Michael Review that are being looked at to try and get that consistency across practices. We've been working very hard with the GPs, and I must say the GPs have been very receptive to the department over the last 12 months in terms of new ways of working. So we are trying to get that consistency, but the model of healthcare that has been in place since the NHS was founded in 1948 is that the GP practices are effectively independent practices commissioned by the department to deliver services. Okay. So we can only dictate in terms of what's in the contract with them.
Okay, thanks, Howard.
Thanks, then. Thanks, Minister.
All right, 14 minutes past 12 midday on the Mannin Line with the Health and Social Care Minister, David Ashford. Here's a question that came in as well, talking of GPs. What did happen at Snaefell Surgery?
So in terms of Snaefell Surgery, we worked through with the GPs what they were entitled to under the new contract proposals that came in from April, and both sides were satisfied that allowed the surgery to develop. The concerns of the GPs, quite rightly, was whether they'd have enough money going forward under the new contract to be able to do development within the surgery, because they are very committed community GPs at Snaefell, and they wanted to be able to develop the surgery and move on, not just stay standing. Once we'd run through everything with them and being able to give them an understanding of what they'd be entitled to under the contract, they were happy with that and therefore withdrew their notice.
OK, there's a question that came in from Karen who said, could you clarify the restrictions between day 7 and day 10 and 2 clear tests? Many families, including my own, booked when 7-day isolation was announced. At the time it was stated pubs, theatres and any public gathering places were restricted between day 7 and 10. It now states only one trip for essential shopping between day 7 and day 10. So what about families who've booked in order to see grandparents, grandchildren, elderly parents in their own home? Many can only stay for 10 days, and families who've waited for 14 months to see loved ones are in danger of only meeting them over a garden fence.
Well, I've got to be honest and say I'm not sure where that only one trip for essential shopping has come from, because that's not my reading of anything that's on the website or the regulations themselves. In terms of going into crowded places, it is suggested you can only do so for essential shopping, but there is nothing, as far as I'm aware, to prevent people in non-crowded environments from going about their business as normal.
When do things start to really free off on the island? So
we will be considering, hopefully in the next week or so, people will know from the exit framework that there's another change, hopefully to level 2 at the end of May, at the end of this month. Hopefully council and ministers will be able to discuss that over the next week or so, and then we'll be able to make public announcements. As always, have to put the caveat in that it's subject to, well, not just what's happening here on Ireland, but what's happening around us. But we're hopeful at the moment that the data's looking good, that we can move to that next stage as planned at the end of May.
How do you read the situation in the northwest of England?
So the northwest of England, to be honest, is fluctuating. There's some areas in the northwest where the figures are coming down quite dramatically, but there's other areas that are starting to see spikes. What we've got to be very careful of is that we don't just take individual local authority areas in the UK, because the data only relates to residents. It doesn't relate to those who work or travel through that particular area. So, as with everything, it's a bit of a perception game, to be perfectly frank. But the data is looking good, and we're confident that hopefully we can move to those extra changes at the end of May.
OK, here's a message from the answer phone, and it goes...
I'd like to ask Minister Ashford if he thinks it is appropriate to send people on the Isle of Man Transport minibuses as patient transport home when they have recently undergone serious operations. I was brought home last week on a minibus. I've had a knee operation and couldn't sit straight because I couldn't fit my leg under the seat in front. And the other 4 people on the minibus with me had all had hip operations. The first person on the bus had to wait an hour for everybody to be collected. And I think that in the circumstances, people who are just coming out of hospital or who are being transferred from Noble to Ramsey Hospital should be better treated than they are being at present. Thank you.
Well, I caught some of that, Andy. I didn't catch all of it. But in relation to the minibuses and the service provided by DOI, the buses are designed to be able to transport patients, particularly after surgery. If there is people where it's felt medically they're not able to use a minibus, there is still the option of them having taxi services home, but that has to be medically approved. The person who's in charge of the person's care will actually decide what is appropriate for them to be able to travel home.
And at what stage do they approve a taxi? What does somebody have to ask for it, or will the person in charge of the care decide on their behalf?
Well, it's both. The person can request, but then it would have to be medically assessed and agreed by the person in charge of that person's care. If the consultant themselves, who's the person who's actually been treating the individual, so knows their situation, feels that a minibus isn't appropriate, then they can proactively allow for other forms of travel. Many people, in fact, sometimes travel in family cars. Obviously not during the lockdown period when it was a lot more restricted, but in normal circumstances like now, many people actually get family members to transport them as well. OK,
Jason, you're live with David Ashford MHK on the Mannin Line.
Hello. I have to say, David, I think you're very brave putting yourself up for questions that could be quite sticky.
I'm always happy to try and answer, Jason.
Well, good man yourself. I'm a bit worried about the fact that a top virologist called Gert van den Bosch, who has been right at the top of his game for Bill and Melinda Gates, the German Centre for Infection, GSK adolescent vaccine programme, has put out a YouTube video, so I'm surprised it's actually still up, pleading with the WHO to stop the vaccine. He believes that a human intervention is going to make this worse by what he calls viral immune escape. He says that these vaccines are brilliant, but they're being used in the wrong way, and that these, these variants are actually being caused by the fact that people are being vaccinated.
And what's your opinion, Jason?
I'm just a layman. I'm trying to be as informed as I can with what's out there.
And have you been vaccinated, Jason?
No.
Will you be vaccinated?
No.
Okay. Minister?
Yeah, so if I can come to that, Jason, I have seen that video and I am aware of it, and the vaccine immune escape argument that's being put forward. There is always going to be people on various different sides of the argument, particularly when it comes to vaccines. But what we have to do is actually look at the data of what's actually happening. So in those countries that have had very strong vaccination programmes, such as Gibraltar, the UK itself, Israel, the evidence is there on the ground of the way it's starting to suppress the spread of the virus. In relation to the argument that it's the vaccine causing the mutations, viruses, when they spread person to person, mutate naturally. And in fact, the biggest point against that argument is if you actually look where the majority of those new variants are coming from, they're actually coming from countries with a very low vaccination rate. So if the vaccine immune escape argument actually held water, you would actually be seeing more mutations coming from the high vaccination countries, which just isn't the case.
Right, okay. Oh, that's interesting. That's really interesting. Okay.
Thanks for calling us today, Jason. And here's John with us on the Mannin Line. You're live with David Ashford MHK.
Alexa, stop. Hello.
Hi, John.
You're live on the air, John.
Hi, I'd like to talk about podiatry, please.
By all means.
I go to Kensington Road Podiatry because I'm type 2 diabetic. I've been ringing trying to get an appointment there, and they're saying because of the COVID, they're still working on February. I was down for April, and they're still working on the list from February. I've tried 3 private chiropodists this morning, and none of them are taking any new private patients on. My nails are curling under.
Yeah, it's a serious issue across all of the services, I'll be perfectly blunt, that health and social care deliver. We have got lists backing up. I know podiatry is one of those. Manx Care at the moment is in the position of going through the services service by service to see what additional support we can get in to try and bring those lists down. Now, that's not any comfort to someone like you who is waiting, but we are trying to prioritise and get those lists down and trying to see what additional resource we can bring in. One of the issues we have is, of course, that the UK is in a similar position, so the amount of additional resource we can source from there is limited because quite naturally they're looking at their own lists and what they need to do to bring those down. But podiatry is one that I have got flagged, and I know Manx Care has got flagged to look at to try and see what we can do, because the list over COVID period, when they couldn't undertake hands-on consultations, has radically grown.
John, have they said how long it's going to be before you get in?
Well, they've just said they're working on February at the moment. I was down for some time in April. We're in the middle of May now. I've rang again this morning to say that and left a message on the answer phone to say that I've rung 3 private chiropodists and nobody's taking any patients on, pleading with them, trying to get me in.
And are you in pain, John?
Well, it's getting that way. When you start putting your shoes on and your toenails are rubbing at the end of me, I'm going to have to go and buy a larger size pair of shoes if I don't get.
I mean, if it's getting serious and it's impeding you, then the thing I could suggest is going to the GP and getting them to make an urgent referral into podiatry and see if that can help speed it up. But like I say, there is an issue. I'm not going to shy away from it. There's an issue not just with podiatry but other lists as well, and we need to start getting those down. And I know Manx Care is trying to get resource in place to be able to do that.
Okay, John, keep us up to speed with what happens. Thanks for calling.
Okay, thank you.
All right, Stephen is with us live on the Mannin Line. Hello, Stephen. You're with the Minister.
Good afternoon, Andy. Good afternoon, listeners, and good afternoon, Minister. What I'd like to talk about, if I could, is the Corran Memorial Home in Peel, David. Can we talk about that?
Yeah, we certainly can.
Well, firstly, I'd like to declare my mother and my aunt are both in the Corran, and they are perfectly happy with the arrangements in there. And there's other Peel residents who enjoy the respite and the care that the Corran has to offer. And I wondered, David, you will have had a note from the staff working group asking for a moratorium of the notice to close the Corran home. And I wonder, will you support that request until we can look at the strategic needs in the West of what is required for the needs of older people?
Well, Stephen, there's no notice of moratorium on the Corran home, so to speak. That is by the trustees themselves, the runners of the Corran home. The Corran home isn't a DHSC home. It's a private home, so we don't have that control over running it. They've served us notice to say that they can no longer run it. It's not, unfortunately, something DHSC can step in and actually run, or Manx Care. There is issues with that building. I think there's various different issues that need to be addressed. There has been meetings with the trustees. The CEO met with the trustees last night. I'm due to meet with the working group on Friday, so we can talk through. Various options have been talked through, because I know how important to the community it is to have a facility like that in the West. It's also played a major part in the development of the Western Wellbeing Project and the integrated care that we're wanting to roll out across the rest of the island. So it is important that in the long-term future of care in the West is actually maintained. I've been working very closely with the two MHKs for Peel and Glenfaber and keeping them up to date, Mr Boot and Mr Harmer, to try and come up with a solution. But unfortunately, the solution isn't that Manx Care can simply step in, because it wouldn't be able to operate the building as it stands because of the legacy issues with that building.
Well, I know that you're saying that there's still work to be done, and it's not within your gift because you're not the ultimate owners of it. But I believe that Catherine Magson last night told at the meeting that there would be no rescue package put forward for the Corran home. So that's a little bit different.
Well, that's not quite correct, Stephen. What I can say is. What I can say is that in relation to that, what was made absolutely clear is we can't provide the trustees with funding. It's a private home, and if DHSC was to do that, then quite rightly all the other private homes on the island would expect that should they encounter financial difficulties, then DHSC should be in a position to bail them out. So that was made absolutely abundantly clear. But what I'm saying is that is a very key strategic site. There is issues with the building, and it's more than just minor issues. There was actually some major issues with it.
Well, what are the major issues?
So, for instance, there is under the R&I. So registration inspections are going in to do another assessment, but one of the wings it just isn't fit for purpose. And in fact, actually, if it was new operator coming in, it wouldn't be agreed for that operator to take over with the situation it is. It can still operate at the moment under the legacy.
Absolutely, and that is the whole point. There is a lot of homes in similar situations to the Corran home where they have grandfather rights and they can continue lawfully to operate within the communities they serve. Is that not right?
That is correct, but of course the moment the trustees finish and a new licence is applied, it's no longer grandfather righted. So that includes if the department took it over.
That is absolutely why there is a need now for subvention from the public purse, because, as you will be aware, the charges in the Corran are very reasonable. And I've done a back of the packet exercise, and if you looked at a couple, certainly for my family, you'd be looking at the government pay the subvention now because we're as poor as church mice. So the government is paying their fees now. And if and when you move these people out to another home, then the fees are going to be raised dramatically into the tune of $24,000 per person.
I'm afraid I do have to be clear on this, Stephen. The DHSC cannot subsidise private homes. If we go down that line with one home, no matter how well-meaning, it opens up the possibility of every private home on the island seeking funding from the taxpayer, and that would not be appropriate. It is not an option that's on the table for us to subsidise the trust continuing to run, because, like I say, quite rightly, other private homes would then be saying, "Well, where's our funding to ensure we can continue to operate?"
What would happen if today the Corran home announced to you that their fees are going to £50,000 for the current residents, and those that are paid out of the current purse would then, presumably you would pay the extra amount, wouldn't you?
No, there is a limit on the amount of fees that are payable by the taxpayer.
OK, Stephen, I'm sorry, we've got to leave it there because lots of people backed up on the line, but thanks for getting in touch. And here's Dewan on the Mannin Line with David Ashford. Hello, Dewan.
Afternoon, Andy. How are you?
We're fine here. Lovely view out of the window.
Absolutely beautiful view, isn't it, on our lovely island. Good afternoon, David.
Good afternoon, Dewan.
I'm sure you never signed up for this when you joined politics.
Well, I certainly didn't predict it anyway. My crystal ball failed on this one.
been an interesting 12 months, hasn't it?
It certainly has.
I've got 4 questions for you, David.
Yeah, of course.
Probably short answers. Obviously, people, I mean, the government themselves told people to go out and do their own investigations on stuff and basically don't waste the doctor's times and investigate stuff yourself. So I just wanted to ask, and I'm sure there's a lot of people that want to know some basic questions. And COVID-19, is it still a pandemic or was that downgraded?
No, it is still a pandemic because the pandemic's declared on a worldwide basis by the World Health Organization. So although it's coming down, if you actually look at the case numbers around the world, they're still pretty static. So it is still classed as a pandemic.
It is still classed as a pandemic. Okay. And the second question. Is the vaccine still under experimental stages? I believe it is for the next 2 to 3 years.
Right, we need to be clear about this because this is some of the things that's got confusing. Once the vaccine is released, there is still trials that always carry on, and normally for about 2 to 3 years afterwards. So that includes seeing the long-term effects of the vaccine, seeing if there's any particular issues with cohorts. So, for instance, one of the studies that has come out since the vaccine's been released has been around transmission, that is showing that the vaccine radically reduces transmission. Those kind of studies carry on with all vaccines. This is nothing unusual. That doesn't make the vaccine experimental. It has been authorised for use. People are getting that, I think, by the fact it's under an emergency. It's under an emergency licence. An emergency licence simply allows it to be authorised for immediate use, whereas sometimes the licences can take 6, 8 months, 12 months to approve. It doesn't mean it's an experimental vaccine.
Yeah, I think just on account of that, I think the problem that a lot of people have, obviously, is the other side of the coin that talks about this stuff. There seems to be a great effort to take a lot of this stuff down from any kind of media. So it makes people obviously cautious that the only agenda that they're hearing is the government agenda, and they're not hearing what's coming out from the World Health Alliance and other parties that are involved in looking into this. So I think that causes a lot of scepticism. The third question I wanted to ask you was, is there an mRNA messenger operating system involved in the vaccines?
There is. I honestly don't know, to be honest. I know there's mRNA is part of the vaccine process, but in terms of messenger service, I'm not sure.
Okay, and that's quite an important thing. I mean, if people are going to start messing around with people's immune systems and diverting them to fight one army instead of fighting other armies, then you might have a problem come the winter.
Okay. Right. Sorry. I have just cottoned on to what you were saying there, so I can answer that, and the answer is actually no.
Okay, so there's no mRNA messenger in any vaccines?
Not as far as I'm aware. Not the messenger side. Yeah. So it's not diverting away from the body, because I've seen something on this. You've just recalled my memory. Right. It's not diverting away from it attacking anything else or preventing any other illness.
Right, okay. Because some of the stuff that I'm reading is it's actually diverting your immune system to fight a specific thing, which is this COVID-19.
Yeah, no, that's not correct. I've seen a paper around that in the last couple of months. You've jogged my memory there with the last piece you said.
Okay. And the last point that I wanted to get over for you today, the new Manx Care System, I was at your meeting before Christmas, which you did at Ramsey. And, I mean, obviously there's been a lot of money spent on the Manx Care System. I just wanted to ask you, I mean, you've got a hell of a battle on now with the care system here. There's a huge amount of people that I see, and I'm talking to a lot of people who are waiting 4 and 5 years for them to get exploratory stuff done, which is kind of crazy. So good luck with the battle, because I think you've got a big battle. The Manx Care System, is this a smoke and mirrors to take the emphasis away from government and put it onto a different body? Because there's going to be a lot of problems coming down the line?
No, it's most definitely not smoke and mirrors. The initiative around Manx Care came out of the Sir Jonathan Michael review and was recommended by Sir Jonathan as the independent assessor of the health service. I've made quite clear, although the structure's changed and Manx Care is arm's length, ultimately the buck still stops with me as Minister for Health and Social Care. So certainly I can't use the excuse and say, oh, that's Manx Care's problem. I've still got to answer the questions and be the front face politically. It should actually improve things, because Manx Care, and we're already seeing some changes happening within Manx Care behind the scenes, because instead of having people being pulled both ways between policy development and implementation, and also trying to deliver the services on the ground. With Manx Care, we've got an organisation that is purely focused on that delivery aspect, and already we're starting to see Manx Care coming forward with proposals as to how we can improve that delivery. You mentioned there again about waiting lists. Some of the waiting lists, I'll be honest, are frightening, and we need to get them down. And Manx Care is already, because they are purely delivery focused, drawing up plans as to how they can actually do that.
OK, thanks, Stuart.
Thanks, Andy.
All right, here's a note in from Jeff Corlett, who just said to the Minister, I've been admitted to Broad Green a week ago. I'm due to have surgery on the 19th. My jab was due to be on the 17th. What do I do?
If the jab is due to be on the 17th and he can no longer have it, it's obviously due to medical purposes. If he rings 111 and explains or emails into the team, then they will try and get it rearranged for him. OK, well, live on the Mannin Line today, the Minister of Health and Social Care, David Ashford, through till 1.
This is the Isle of Man talking, the Mannin Line.
With Shaw, you can share your unlimited data, calls and texts. Get one of our new sharer plans and you can share your unlimited data, calls and texts with up to 4 members of your household from just £12 extra per person per month, and with everything itemised and showing on one simple bill too. Switch to Shaw to save or upgrade your account and start saving more from today. Visit shaw.com and remember, you'll always
Athol Garage in Ballasalla is more than a Nissan authorised repair centre. Their team of highly factory-trained and experienced technicians will service and repair any make and model, with dedicated aftercare too. With Athol, you get a competitive fixed-price menu and a courtesy car if needed. Pity this driver didn't know that.
Oh, great! I told you to go to Athol!
Athol, a garage to swear by, not swear at. Book now at athol.im or call the 18 820082.
What are you thinking about right now? Perhaps looking for a new job has been on your to-do list. Then today could be the day to go for it with Orchard Recruitment. Recruitment specialists in the financial and IT sectors, Orchard has a wealth of opportunities. Whether you've recently graduated, lead a team, or are an appointed director, empower yourself today. See the varied range of opportunities at orchardrecruitment.com.
Orchard Recruitment, a refreshing change.
You're sure to find something fabulous at Ramsey Art Gallery, Jewellers and Engravers.
From stunning gold and silver jewellery that you can make extra special with an engraved message, to local prints and gifts for every occasion, Ramsey Art Gallery also stock a fantastic range of watches, including Ted Baker, Citizen, Storm and Accurist.
Plus Seconda, Timex, Sexy and Bolivar.
All with lifelong free strap adjustment. You'll love what you find in store when you visit Ramsey Art Gallery, Jewellers and Engravers, opposite the RNLI shop in Ramsey.
The Mannin Line with Andy Wint.
Good afternoon. We're live with David Ashford MHK, the Minister for Health and Social Care. A note in just said, I'm impressed with Mr Ashford's knowledge base and ability to answer many diverse questions under pressure. As a non-clinician, he has a great clinical knowledge as well. Where do you get it? You must read everything.
I'm very sad like that, Andy. I do like data and I do like medical reports, so I do tend to read an awful lot of what comes out. At the end of the day, I'm not a clinician, so I'm not going to be able to delve into the real detail, but I do try to digest and understand as much as I possibly can.
And obviously you're surrounded by people giving you different opinions. You've got clinicians, you've got civil servants, you've got fellow politicians, you've got members of the public. How do you make your mind up?
When it comes down to that, it has to be a balance. I mean, thankfully, it's very, very rare where you end up with 4 or 5 completely diverse decisions, or opinions, sorry, I should say, from people to make a decision of. Normally, there is somewhere in the middle where people agree. So it's getting to that point normally. It's very, very rare where you've got completely polar opposite views with people saying you should do A, but or go to Z. That's quite rare.
OK, David's with us on the Mannin Line. You're live with David Ashford.
Hi, David. Just a quick question.
Hi, David.
Mate. I just wanted to ask you, regarding your role now as Minister, but as an MHK as well, is your role between you as the Minister of the Department who's responsible for health and social care to Manx Care, and that connection between it? And just a quick little throw-in is, who makes the policies? Who then divvies up the money? And if you could give us a little floater on that, and just quickly, because I won't bore you too much, I think there's a lot of care homes that will struggle. It's probably been happening a little while at Peel, and I wonder why it wasn't flagged up, to the department where there were shortcomings, like there was at still Albert Terrace there by the museum and Glenside, where actions were taken and a plan was put together. And I'll leave you at that, and I'll listen.
Yeah, well, if I take the last point first, David, it's probably easiest with the Coven Home. I know there have been conversations with registration inspections for quite a while. It's not something new. What did come out of the blue was the trustees saying that they weren't willing to operate the home anymore. They couldn't operate the home anymore, I should say, going forward. That was the bit that came out of the blue. I know there had been discussions previously when I first became minister, which is nearly 4 years ago. I know there was some discussions around other aspects of the home and the long-term future of the site. In terms of Manx Care, so the department basically, which is me as minister, the department members, and then the senior officer team within DHSC, we develop the policy. Manx Care has to come through us for the budgets, and then it will be the department that goes to Treasury. So we're basically the facilitator for Manx Care, and we will present the budget requests each year to Treasury. So the business cases for Manx Care come through the department and myself first. Each quarter there is what's termed a partnership board, where the boards of DHSC and Manx Care mix together, and we will actually meet to discuss issues. That also has Treasury representation on as well, and basically that will allow us to be able to get more joined up. I also have regular one-to-ones with the chair of Manx Care, Andrew Foster, on what I term a no surprises basis. So it's an opportunity for me to share where we're going policy-wise, and for him to share with me where we're going delivery-wise, so that we can be joined up. Because you're quite right, and the point you're getting to is it's important we don't end up with two organisations going off on different paths, and that is always the risk with something like this. But the processes we've put in place are to make sure that Manx Care and the department can work hand in glove.
Thanks, David. And I'll leave you, Andy. Bye.
Okay, well, thank you, David. You're many things, but never boring. I'll give you that. It's 17 minutes to 1, and we got Peter on the Mannin Line. Hello, Peter.
Hi, good afternoon. I'm just wondering when and how we can get proof of being having both the jabs, so we can travel abroad again. How we can get it and when we're going to get it.
That's a very good question, Peter, and I know there's a lot of people that are interested in this. We're currently in discussions with the UK government, because anything we do would have to be recognised internationally, so it'd have to meet an international standard. There's no point us producing a piece of paper for people if that then isn't going to be accepted by other countries. So what we are looking to do is to piggyback off what the UK is doing with the various apps that they're looking at the moment, and we'll be looking to see if we can be a part of that. The initial conversations have gone well, and I think we will be able to do that. So that is, as it is in the UK, a work in progress to ensure that we can get that in place.
Well, where do you want to go, Peter?
I want to go to my little villa in Spain.
Okay, all right, thanks for that. Here's a message with lots of emails and texting as well. I won't spare your blushes, Mr. Ashford. I'd like to thank David. I think he's done a brilliant job, done well. And another message in just to say, well, this is inevitable. I wasn't going to say this, but I will. Somebody's mentioned it. Are you standing in Douglas North, and will you put your hat in the ring for Chief Minister?
Right, well, I've got to be honest, I haven't had time to think about standing again. I haven't made my mind up. I'm going to do that in the next couple of weeks. The likelihood is I probably will stand again. I was going to decide initially at Easter, but then unfortunately other things happened and I didn't get round to do it. The likelihood is I will, but I'll formally make my mind up in the next couple of weeks.
A question from Bob.
Sorry, I was just going to say about the Chief Minister bit, Andy, so people don't think I'm avoiding the question. I was asked this by someone else from Manx Radio yesterday, and at the moment I can't see myself as a candidate for Chief Minister if I did stand. I think there's other candidates out there who are perfectly capable of doing that position next time.
Okay, Bob on Facebook. My 72-year-old wife is in need of a hip replacement. She's been waiting for 18 months. Last month she fell down the stairs. Her leg collapsed. We've now been told the wait will be 2 years. If we pay for the operation in the UK, would the government contribute to £13,500.
We aren't legally allowed to, under the NHS Act, contribute to private operations. Unfortunately, there is actually a bar in law from the NHS funds being able to be used in that way. But what is very concerning, and I've said this throughout the show, is the waiting lists. And the
there
waiting
must be a tidal wave of
in
waiting
orthopaedics,
lists.
particularly. I want to pay tribute to the staff in orthopaedics because they've been working exceptionally hard to try and manage the lists. And it's been one of those things, because of elective surgery, that's had to be shut down every single time we've had a lockdown. So again, Manx Care, this will form a major part of Manx Care's waiting list initiatives that they're developing, because orthopaedics is one of the crucial pinch points that we do need to get on top of, because there are people who precisely like that gentleman's wife who are in urgent need of an operation. The frustrating thing is the UK is in a similar position with their NHS lists, so we're just going to have to see what extra resource we can bring in to assist on that. But those waiting times, I'm going to be perfectly blunt right here in public, need to come down.
Well, we're behind time as usual whenever you're on the Mannin Line, Minister. A note in, this is from Philip just said, when's the private ward going to open at Nobles?
So again, I hate to say something else was delayed by COVID, but we needed to use the private ward for the isolation rooms. We're now looking to start to slowly reopen the private ward as we go through the rest of this year.
Have you appointed an operator?
No, so what we're likely to be doing in the first instance is having Manx Care run it independently, because we had a large amount of expressions of interest from private operators, but they're currently, unsurprisingly, snowed under with the COVID response in the UK and things being directed at them. So we may not be able to go out to tender to next year, but we don't want to leave it to next year and keep the private ward shut. So we are looking at an interim solution in the meantime at the moment to allow people to have private access.
All things being equal, if you went out to tender next year, when could a private operator take over?
Well, it would depend when the tender went out. If, say, we put it out in March time, if we kept to the original specifications, we'd have someone in place in June.
Your Minister of Health and Social Care is on the Mannin Line. We have 12 minutes left.
Looks like the Manx Shearwater has returned early this year.
Shearwater? Your investment plan with Ramsey Crookall?
No, the bird.
Oh!
But you're right. My Shearwater should make some impressive returns too.
Wish I could afford to invest.
You can. It's flexible and really affordable. Invest a lump sum or a monthly amount. It'd be a great way for you to get started.
Shearwater from Ramsey Crookall. For 75 years, the island's investment specialist, offering a wide range of services to make your money work for you. Call 717171 or visit ramseycrookall.com. Licensed and regulated by the Isle of Man Financial Services Authority.
Don't miss this amazing new boiler offer from Manx Gas. Replace your old boiler with an ultra-efficient Valiant boiler, including 5 years free servicing and priority care, plus a 10-year manufacturer's warranty from just £39 a month, with 5 years interest-free credit. For comfort and peace of mind, get a brand new boiler now from Manx Gas. Call 644 444 for details or visit manxgas.com. Terms and conditions apply.
Here on the Nation Station, we're springing into action with B&B Furniture to give away a brand new bed worth £499. Just call into B&B on the Snugborough Trading Estate and find the celebs in a bed. Tell us who they are by texting 166177, starting your message with the word bed and including your name. All correct entries will go into the big prize draw live on Manx Radio on May 17th. Celebs in a bed with B&B Furniture and Manx Radio.
The Mannin Line with Andy Wint.
And the Minister of Health and Social Care, David Ashford MHK, is with us. Could the Minister tell us what the future is of Abbotswood? It must be one of the best unused care homes on the Isle of Man. I understand it's been done up, hasn't it, inside?
It's a private home, so I don't know what the future is. It will be up to the owners what they want to do with the building, because it is not something that is owned by DHSC. It would depend if they wish to apply for a licence for it to be reopened as a home and go down that route, or if they wanted to utilise it for something else. That would be entirely in the owner's hands.
Obviously, in terms of care homes around the Isle of Man, are we under capacity, over capacity, or do we have just about the right amount?
depends upon the type of care, because there is various grades of care, including EMI. I think EMI we could probably do with more on the island.
EMI is
so sorry. Yes, I've gone into the jargon there. In relation to EMI, it's those that suffering from dementia and so on who need the high level care. In relation to general nursing care, I think we've got probably just the right amount, and then high level care we could probably do with a bit more as well. But I think the key point is we don't just need to look at what we need now, we need to look at what do we need in 20, 30 years time, because you can't just build a care home overnight. So that's what we need to look at, and I think we do need further development to ensure that we can keep up with demand into the future.
Okay, and again, more questions on Manx Care. Could you ask the Minister, what's the difference with Manx Care as just a normal hospital? What's the difference?
So the difference is Manx Care, there are differences, but it's a bit like a unitary trust in the UK. So they are completely and utterly separate. It's not just the hospital. Manx Care also includes the Children and Families Division, the Mental Health Division. It is all the operational divisions of health and social care, and they are purely focused on the delivery of services. So they don't develop policy or implement policy. They purely actually look at the delivery of care. And
this was Sir Jonathan Michael's recommendation.
It was the absolutely key recommendation from the Sir Jonathan Michael review.
Are you happy with it?
I am, and I think it's already starting to have some effects on the ground. And I think the fact we're able to focus more on the patient care, it will take time for the public to be able to see the change, but I believe the direction of travel, the public in a year or so will be able to see a real difference.
OK, could you ask David Ashford about improving ventilation in hospitals? I went for bloods at Ramsey Cottage Hospital last week. Although social distancing and mask wearing, no windows open in hot waiting rooms. In fact, the security man shut the door. I asked him to open the windows, and they did, but NHS employees should be more aware of this. Ventilation in hospitals.
Yeah, ventilation's crucially important. It's one of the key things in relation to COVID-19. In fact, I want to praise one of my colleagues in the House of Keys, Mr. Robert Shaw, who's MHK for Douglas East. Mr. Robert Shaw's been raising ventilation for a long time. What I will do is I will speak to the CEO of Manx Care around that, because certainly hospital spaces, where and when we can, unless there's a clinical reason we can't, we should be ventilating.
What's the current advice regarding use of sanitizer and washing hands?
So the advice is that you should sanitize and wash hands as frequently as you can, wherever possible, because that is one of the other major things that will combat the spread of COVID-19. We know that the majority of spread is through people touching and then touching their face, their mouths, their eyes.
OK, it's a question about the Chief Executive. When will Catherine Magson, when will she come to the island again? Can she do her job being in the UK?
She most certainly can, and in fact, actually, if anything, and you wanted if you looked in the dictionary under remote working, you should actually see a photo of Catherine. She's done an absolutely superb job as CEO. I can't praise her enough. She's kept on top of everything, and she's been able to do it remotely. We're in the 21st century now, and she has actually gone to show that remote working does work. She will be back on Ireland as soon as we lower the restrictions. She, quite rightly, she didn't believe coming in as a key worker would be right when we were restricting other places, and I agree with that as Minister, but it has not impacted on her ability to do the job. I think she has been an absolutely excellent CEO for the department.
OK, Adam, hello.
Hi, Randy, you're right.
Very quickly, you've got 30 seconds with the Minister.
Yeah, I just want to ask, I've got Addison's disease, which is an underlying health condition, and I rang up the other day to get a repeat prescription, and I was told I had to come in to my surgery at Village Walk to get a repeat prescription. Now, people with underlying health issues, if they're having to go into a surgery to get their repeat prescriptions, they're putting themselves at more risk. So why is it the case that we have to do this at the moment?
It would be a clinical decision by the doctor as to whether they needed to see you before the repeat prescription was issued. I know there's many repeat prescriptions that are issued over the telephone, but on this instance, it would be down to the GP to decide whether or not they needed to physically review you before they could issue the medication.
Right. I get it all the time, but it's I normally go in and just fill out.
I would hope the surgery would have in place measures to protect vulnerable patients, including, if necessary, separating out in the waiting area or staggered appointment times.
Okay, all right, Adam, thanks for calling us today. We appreciate your call. We're out of time now, and the time always flies by. And hopefully we'll see you again soon, Minister. I just want to ask you a final question, and this could possibly a yes or no, and this is from Amy. Are we short of dentists on the Isle of Man? And if we are, when will we get up to capacity?
Unfortunately, it's not a simple yes or no, because the dentists are all private. We don't deliver, other than the emergency dental surgery. Again, going back to the start of the NHS, dentistry is a private capacity, and we commission off the dentist certain amount of NHS work. So I suppose it's one of those real political answers of yes and no, because it's for the private sector to deliver in terms of dentistry.
I understand you've got a busy afternoon. What are you up to?
I'm appearing before the Public Accounts Committee this afternoon into genomics at 3:30. So unfortunately, anyone tuning in there will have to put up with me again for an hour or so.
Thanks for being with us today. We appreciate it.
Thank you, Andy.
Good to talk to you. David Ashford, MHK for Douglas North, with us on the Mannin Line. Thank you for your calls. Thank you for your texts and emails. This coming Friday, the Chair and Vice Chair of Isle of Man Post, Julie Edge and Chris Thomas, will be with us. And tomorrow we're open line from 12 midday. Thanks to producer Barry Redfern, and thank you for tuning into the Mannin Line today.
W